So we're here within our Monday CRM, Monday org. I have my healthcare provider workspace. So if you are not on that one, you'll want to go ahead and go to your workspaces that you have access to and open that. General orientation here. So now we're within a workspace. On the left-hand side, each item you'll see is either a board or a dashboard, or you'll see even some workflows and documents. So each of these are the main items that we're going to be talking through today. So this solution is for healthcare providers who are managing intake of referrals and then working those referrals through the intake or admissions process until they are ready to become a full-fledged patient. So everything in this workflow starts on the referrals board. This is where multiple different sources for receiving referrals should funnel to. So that could be web forms, that could be, someone's getting a phone call and they use this board to create a referral. You can also use eFax or integrate social media platforms where forms are filled out as well. So there's a variety of different options for this referrals board, but everything will funnel to a referral and then we'll move them through the process from there. So let me show you what it looks like if we used one of the Monday work forms embedded on a website to allow potential patients to contact us or request services. This could also be used and shared with referring providers. So if there's any doctors or offices that refer patients to your organization, they could have access to this form to get those directly input. So this form can be fully customized to your specific needs. But first we'll start with putting in the patient's name, date of birth, phone number, email, and every field here that you see that has a red asterisk is a required field. But again, this form can be customized. I'm going to go ahead and continue filling in the required fields and then show you what this looks like. So here I'm just gathering some insurance information. I selected the insurance name and I'm putting in my member ID and my group ID. And this is a customizable dropdown, but I'm selecting the services that I'm interested in. I'll opt into email and SMS. And then once I'm finished filling out the form, I click submit. And then that would be the end of the process for the person filling out the form. So again, this could be embedded on your website. A patient could fill it out, a referring provider could fill it out. But then once it's submitted, that will push it here into Monday. So let's go look in our open referrals view. And our new referral, Susan Myers, you can see is now down here in this bottom row. So from here, a care coordinator or intake admissions specialist, whatever that title is within your organization, would view the list of new referrals and triage them as appropriate. So maybe the next step is to contact this individual, give them a call, send them an email. If you want to send an email, you'll go ahead and open up your referral. This is the item page for this referral, Susan Myers. I can see my emails and activities section, and this is where I can click new email, put in a subject, and body of the email. Then I could send this out. Depending on if you use Google or Outlook, you can connect your account directly and the emails will be sent via that method. All right, after contact, maybe the next step is to gather additional information. So maybe you've had email communication or you spoke with Susan on the phone. Over on the right-hand side is all of the information we've gathered so far for this referral. And we'll just continue to fill that out until we have everything we need. So let's go ahead and link them back to their referring provider. So we know Dr. Carissa Lang was the one who referred this patient. I can make a connection there. I have their insurance information. I could upload their insurance card. So there's just a variety of different columns here that we can gather additional information. Most importantly, the status column is what we want to keep updated so that as we move this person through the process, we know exactly which stage they are in. So I just updated Susan's status to contacted, and she's now down here in our in progress referrals group. So this is another way to help keep your referrals organized so you can go in and see exactly what you need to see. After the referral, we have everything we need and we're ready to begin the next step of the process. We will use our convert button to push Susan's record from here on the referrals board over to the patient's board. So let's go ahead and take a look at our patient's board now. The purpose of this board is to store patients that are either in the intake process or active or discharged patients. So we are now creating just a separation between referrals that require additional gathering to patients that are more qualified and ready for services. Since we understand that within the healthcare industry, patients may require services for your organization in multiple instances of care over time. How we've structured the data is that there's a patient record and then multiple patient intake records to continue the process until they're fully admitted patient. So from this board, we see our Susan Myers record. We can go ahead and click Start Intake. What this button does is it kicks off the creation of a patient intake record, and you'll see that moved our patient to intake in progress status, and it created that intake record that we see here. I'm now able to go from here to update the record, or I can go to our patient intake board to do so. So on here, I have my Susan Myers intake record. That's the one we're just looking at. And I can continue to fill in information and details as I gather it. So sometimes in this intake process, there's additional questionnaires, maybe assessments are performed. And so all of that functionality would happen in this phase. Once all of that's complete, the patient is ready for admission. We'll go ahead and change the status to admitted, select their treatment location and the admit date. And that will successfully update their status to admitted. Back on the patient's board, that will also update Susan Myers' status to active patient. And the final step here would be to push them over to the EMR. So this is where integration is triggered to your EMR to eliminate that swivel chair between your CRM and your practice, your healthcare system. So by clicking this button, that will push the details over. We can see that the population of the created date occurred. And then once that integration continues through, the medical record number will populate as well. So we have that ID. So that's the main workflow, referral through intake through patient admission. There are some additional boards that we have set up here to support integration after patient admission. For example, we have an appointments board, which can sync appointments from your EMR to Monday so that you have visibility and insight into those patient appointments. You can also then, having this data in Monday would enable you to send maybe SMS or email reminders from Monday, or just provide that visibility. Similarly, we have a board for prior authorizations. So sometimes prior authorizations need to occur before care can be provided. So if that process is happening either in Monday or the EMR, there is a board here that will help you manage that. Claims is another board which will pull from your EMR to show insurance claims over time so that you can manage your billing out of Monday. Or again, just have visibility into that here in Monday. So those are our main EMR boards. And of course, if there's additional EMR data points that are necessary to see within your CRM, we can configure those. Few more supporting tables or Monday boards before we move on. We have talked a bit about referring providers. So to be able to see, which providers or accounts are sending a lot of patients your way, to see kind of that ROI on maybe marketing efforts and relationship nurturing with those referring providers. The best way to do that is capture them in two different boards here. So one is an accounts board. This is where you would store more so the companies that these providers might work for. So you think, different medical groups, hospitals. So you can see they're listed here. They can be assigned priority. Additional details can be gathered. And then there's two columns that are really helpful. One is a link back to the providers, which are on a separate board that work at these facilities, as well as the patients that have referred. On the referring providers board, this one shows the people. So think physicians, nursing staff, caseworkers. That could be the actual person or contact that is providing a referral to you for a patient to your organization. So here we have their contact information, first name, last name, title, their affiliated practices, patients, and any additional details you'd want to gather. And then finally, one last board that's supporting some automations within the system. So oftentimes we found when it comes to referral management, there's a variety of rules that dictate how referrals get assigned to the teams. So sometimes that can be location-based, that could be service line-based. And so there is an assignments board down here, which allows you to define what is the assignment criteria. So this top grouping is by location, the bottom is by treatment type, and you can see that it includes the value that would trigger the assignment and then who the person that should be assigned is. So there's already automation set up in the system to assign individuals to referrals or intake records based on these values. If you need it further customized, that would be something that could be easily done here. The referrals dashboard is pre-built. So this will give you referral breakdown. So by status, service line, average time to conversion. So what that means is from creation till when they're actually converted into the patient or next stage of the process, by insurer, referral source, and then state. So this is a pre-built dashboard, but could be fully customized